So today I'm talking about post-inflammatory hyperpigmentation with acne. Now, up to 2/3 of people with acne are going to get those pesky dark marks after the blemishes subside, and they cause almost as much anxiety and in some instances more. So what can we do to tackle those dark marks whilst tackling the acne to really get it under control? So today I'm going to be sharing all my tips and tricks. My last video on hyperpigmentation clearly reached you guys because so many of you tuned in, and I'm hoping that today we can go further solving one of your biggest concerns. Now make sure you stay right to the end to get all the hacks for treating PIH so that you can take charge of your skin today. So let's talk about what causes post-inflammatory hyperpigmentation, or PIH for short, which is how I'll refer to it in this video. So when you have an area of inflammation in the skin, so it could be a blemish, could even be something like eczema or psoriasis, the inflammatory process irritates the melanocytes, leading to deposition of the pigment melanin. Now, in darker skin tones, that will look brown in color, so post-inflammatory hyperpigmentation. In lighter skin tones, it looks more red, so post-inflammatory erythema. But essentially, they're the same. They are the footprint that tell you where inflammation has gone before. Now, a really fundamental thing to understand about PIH is that it isn't, in fact, post-inflammatory. Whenever we look under the skin into the cells and the fluid around the cells in context of post-inflammatory hyperpigmentation, we actually see ongoing inflammation. So we see things like prostaglandins and leukotrienes, markers of ongoing activity. So the mistake is thinking that these flat brown or red marks are quiet. They are not. So what that tells us is that even when the blemish has flattened down and any angriness has gone from the surface and they look static and flat, these little flat marks on the skin, there is still activity within them. So what we need to do is to keep going with treatment. And I think it's such a common mistake I see with patients is I give them a course of topicals or orals or whatever it might be. And once the blemishes have calmed down, they think, aha, that's it, we're good. We can put down the tools and stop working on treating the acne. But actually, what is fundamental is that we keep going for much longer in the presence of the visible acne lesions themselves. So how does this all play into what I do with patients in clinic? So the first thing is, of course, is to treat the active inflammatory process. And as I said before, that can be topicals, oral treatments, antibiotics, isotretinoin, spironolactone, depending on what's appropriate in the clinical situation. But as far as the topical treatment goes, at the beginning, we're almost always using a retinoid at night and some sort of anti-inflammatory treatment in the day. Now, patients can often get a bit antsy about this. So they see the blemishes starting to reduce in frequency, they're lasting less time. But of course, as the acne blemishes recede, the dark marks become more prominent. So it feels like they're swapping one problem for another, and they're not necessarily seeing the progression. However, from my point of view, when I see them again, usually for the first time at 3 months after we started treatment, I am delighted if all I see are the flat marks that are the consequence of those acne spots. To me, that's when we're winning. We've got fewer new blemishes happening, they're lasting less time. And then what I see in front of me is what I call the tidy up phase. It's time to put in place a plan to actually tackle the pigmentation. So I don't think about that at the first visit. My only goal at the first visit is to turn off the inflammatory process so that we're not getting new blemishes, so we're not still wading uphill in our battle. Now, one of the biggest causes of significant post-inflammatory hyperpigmentation is scratching or fiddling generally with your spots. This is one of the most important things to remember, that any intervention is likely to lead to increased inflammation, which does mean more pigment. So it is utterly, utterly important that you keep fingers away from blemishes. Probably the hardest step to get people to engage with at the beginning, and I really want to emphasize the importance of this, is the use of sunblock as part of that initial therapeutic approach. Now, the reason for that is the post-inflammatory marks, whether they're red or brown, will tend to darken under the influence of UV rays. So if you bear that in mind, if you're treating someone potentially with new ingredients like retinoids and things, and you're not sun protecting, you are potentially going to allow that post-inflammatory change to get worse while you're treating them. So sunscreen must be part of the toolkit from the very beginning. It is an important part of your treatment plan against PIH. Now, of course, the key is to find one that you're happy using, you're comfortable using, it suits your skin type, doesn't leave a cast behind and doesn't clog your pores. And I think it is so crucial because the wrong sunscreen can, of course, cause problems in acne-prone skin. So do research, find one that doesn't feel too heavy, that doesn't feel at odds with your treatment plan, and that helps support barrier function, and that basically you can get on board with every single day and make sure it's non-clogging. So that's what's happening at the beginning. Let's assume we've gotten to 3 months into our treatment plan. Likelihood is that you're using a retinoid and maybe an anti-inflammatory in the morning, whether it's salicylic acid or benzoyl peroxide. And if things are going really well, now is the time to go into what I call the tidy up phase. So what that means is, bearing in mind we know that there's still ongoing low-grade inflammation in the skin, is that we don't want to abandon our original therapeutic approach completely. So firstly, that means a retinoid is still fundamental, both in terms of keeping the pores unclogged, but also helping start that process to reduce the amount of pigmentation in the skin. Now, remember, pigment can sit in two places. It can be in the epidermis as a consequence of the ongoing activity in the acne, but it can also disrupt the basement membrane and spill down into the dermis, which of course means longer lasting pigment that's harder to budge. So there really is a big argument for getting on top of this nice and early. So you have your retinoid habit going on. Hopefully that is now well established. And we definitely know that within the prescription retinoid space, there are those retinoids which are somewhat better at tackling PIH than others. So for example, adapalene is less effective than tazarotene, which I guess you might expect. There's definitely a distinction in the potency. However, I do find adapalene to be a good starter retinoid, especially in those with sensitive skin. So it definitely does help improve PIH to some extent. But just be conscious that there is, again, a ladder when it comes to the effectiveness of different retinoids. Now, if you're thinking about going up in strength with your retinoid, do take care, because any increase in irritants in your skin can, of course, also drive the pigmentation pathway. And again, this is particularly true in skin of color. So be cautious about any escalation in the retinoid that you're using. I personally do this quite a lot. I'll see someone who has made good progress, maybe on 0.025% of tretinoin, but I can sense that if we can get them to tolerate a stronger retinoid, we'll get better clearance of the acne, both short-term and long-term, but also get greater cosmetic benefits as well. But do make sure that transition is nice and slow, that you don't overly irritate the skin, particularly in winter when weather is a bit more challenging and can lead to more dryness. Then the next thing to think about are the ways you're going to approach the excess melanin in the skin. Now, my preferred way of doing this is generally to use azelaic acid. Now, you guys know I love azelaic acid, but particularly in this setting where we want not only those anti-inflammatory and keratolytic benefits that we get from using azelaic acid, which really help in terms of reducing the risk of acne relapse. So it's very supportive of the effect of your retinoid, and I'd say they're kind of a stacking effect. However, it's also fantastic for treating the uneven skin tone and the hyperpigmentation that we see as well, because it inhibits tyrosinase function and tends to have an overall dampening effect on the activity in your melanocytes. So it's just a tremendously useful active ingredient because it's got this anti-inflammatory effect as well. So it's really quite comprehensively treating all the ways in which the skin can be affected after you've had a blemish. So azelaic acid, there tends to have to be a really good reason why it's not in the routine as part of my 3 months plus tidy up approach. Now, in those with more serious hyperpigmentation, hydroquinone definitely has a role to play. However, I'm really conscious of the fact that I'm losing all the additional benefits that I get from azelaic acid, which can often be a big part of what's helping keep the acne in control. Now, in some instances, that's fine. Maybe we increase the potency of the retinoid at night, and if it's doing all the heavy lifting in terms of the acne prevention, then maybe there's space to treat with hydroquinone, which is just straightforwardly tackling the uneven skin tone. And I'm more likely to use that perhaps in a situation where I know I have a deadline coming up. Somebody's getting married in 6 months and wants the skin as even toned as possible. So that's often kind of my trade-off. Do I want the acne treating benefits of azelaic acid, maybe a slightly more gradual effect on skin tone versus a more targeted effect on skin tone, but I will get less of those acne benefits? So that's something to decide with the patient in front of you. Now, when it comes to how you use these sorts of treatments, obviously you should be using your retinoid all over because you want to harness all the benefits, not just the acne improving benefits. You want to get the glow, the radiance, and potentially the benefits in terms of aging as well. In terms of treating the hyperpigmentation, I tend to treat all over what we call field change. I suppose more often than not, I'm seeing patients who have quite large areas that have been affected and lots of little areas of PIH. So that's certainly the approach I take more often than not. But you can, in principle, spot treat with azelaic acid. I think hydroquinone, it's harder because it's stronger, and I think you get a better, more even result whenever you treat the whole area. And then what you can do is you can go in with a little bit extra into targeted areas that have more concentrated pigment, with a little bit extra as a second layer, and make your treatment really bespoke, making sure that you blend well at the hairline and the jawline so you get an even effect. I mean, these creams act quite slowly over time, so you have control. And if you think things are going too quickly, you just reduce the frequency and use them less often. Now, there are obviously other ingredients that we use to help improve skin tone, things like niacinamide and vitamin C, AHAs, and even chemical peels can be used to improve the evenness of your skin tone after an acne outbreak and help you get back on the path to having a more even toned complexion. On the whole, my preference is that we use things that are helping with your acne management as much as possible, just because then it becomes an easy to follow strategy that you can use long term. But there's definitely a place for things like peels, again, if you need to act in a more quick, speedy way, again, with a timeline in place. As I say, my preference is always slow and steady. I just think that leads to fewer surprises, less risk, particularly in skin of color. I think a gradual, slow and steady approach makes the most sense. It's the safest and it gives you complete control. But I think it's also about a mindset thing. Anything to do with breakouts, in my view, is really an approach for the long term. These sorts of problems don't tend to come and go. They tend to come and linger. And I think if you always have the mindset that you're managing breakout prone skin, it'll really be the way to help result in better long-term control, but also just a clearer mind. You're less preoccupied with what's going on with your skin because you know you have an ongoing strategy in place that helps you take charge of it. So that's my view on post-inflammatory hyperpigmentation in association with acne. It really is, at the end of the day, all about disease control and management. And then it's about a conscious strategy to helping prevent and treat further pigmentation down the line. And, I am very optimistic when it comes to treating this with topical treatments. I think you can make a huge difference with the right plan. You just need to stay on track, be consistent. That's secret to skincare success, no matter what we're trying to tackle. Remember your sunscreen. It's not an excuse to skip it. And I hope that will help you in achieving a more positive outlook when it comes to tackling PIH in context of your acne. So I hope this hit the spot, guys. My last hyperpigmentation video clearly did. I hope this one helps you too. If so, hit subscribe, hit the like button, and I'll see you again soon. Bye for now.